nurse.
A happy International Nurses Day. This day is an auspicious day for all of you because you all have crossed one more year of dedicated service to humanity. And I would like to thank you all on behalf of all the people who have come to our hospital and who are not present here to say thank you for all the love and care that you have been giving to the patients. It has become like a routine to talk about our Florence Nightingale every year. But then I would like to again mention her, since you all are commemorating your Nurses Day on her birthday. She must have made such an impact on all the people that she met during this Crimea War, and that even a day has been named for her. So I would like to challenge all the nurses also to be like her, so that you will be remembered, by the patients that you have treated, for the patients that you have smiled at, for the patients that you have touched with your hand, or just gone across to give them a kind word.
In the rural area,
hello
the
doctor.
nurse, with her knowledge, refers the patient to the higher healthcare
patient tayo first pregnant na.
Patients with their health.
Hello guys, this is Gimme Smoke. Welcome back to my channel. District Hospital Dimapur nasa. Ito imang tawag hospital din. Sister ko kasi Dr. Ed tabi na. Ito mga bikasi ko na ano wala tan emergency ni mida Aisha sister ko ay magimang tali mo gimita. Regarding this issue, abiyala point of view case kindly let me know in the comment. Obe, doesn't have obe. Abiyala mo alak bite. Das bingan, कि करने रखे समाज में जब वो बड़े पर्पस तो, लेकिन वो आज को सभी ये तो पेट, ये तो येलो कलर ये तो खून खान और जो कौन पूरा जमने कटा काटी का, सब ये तो लिटर खान सब ये तो जब और ये तो सेलिंग का तो ग्लूकोज का, प्लास्टिक का, रबर का सब ये तो जब और ये तो ग्लास का, वायरस का, दवाई ला का सब और इतने फ्लो लेसना और तुझ फ्लो लेसना इतने फ्लो और इतने खाने सो इतने फ्लो ते पोजीशन ना और वहाँ तो इतने डिस्ट्रिक्ट हॉस्पिटल दिमापुर है इतने तो सब मेंटेन करे तो स्पिरिट और
By being advocates for health promotion, educating the public and patient, and providing care and support and saving lives. Nurses' gritty determination and patience are features that they are identified with. We need to know the challenges of the nurses and focus on a future where nurses are valued, respected, and protected. Our future depends on every nurse, every voice to not only be on the front lines of care, but also be on the front lines of change. It is now time to look to the future and call for actions and investment in nursing. Strengthen our nurses, our future. Save one life, you are a hero. Save 100 lives, you are a nurse. I am a nurse.
All my fellow nurses, a very happy International Nurses Day. I would also like to extend my gratitude to all the non-nursing staff who are present here, who is celebrating with us, especially all the staffs of THT headed by our MS. Your appreciation, your participations and dedications and appreciation towards nurses is truly commendable. And I would like to extend my special gratitude. The International Nurses Day is celebrated on 12th of May every year, commemorating the birth anniversary of Florence Nightingale, who laid the foundations for modern nursing. Each year, a team is selected based on the nurses and events that highlights the achievements, development goals, and issues and trends related to nursing. In recent years, the theme was emphasized on the nurses' leadership roles and the increasing investment in nursing and seeking nurses' voice to be heard for a healthier countries. This year, our nurses are future. Our nurses are future underlines the focus that empowered nurses is crucial for the future of the mankind. Nursing is an integral part of the healthcare system. It is lamentable that it has taken a pandemic for the world to see the nurses' value in the society, and both in terms of health and wealth. And the ensuing media coverage has also given the public unique insight into the complexity of nursing, beyond the nostalgic stereotypes. Like, people have seen nurses caring for ventilated patients, using technology to communicate to loved ones, saying goodbyes, helping the patients say goodbyes to loved ones through technologies, leading, screening and delivering and vaccination services, etc. Fighting for PPEs, those are the aspects, the unique insights that the people have seen. Nurses are often the first healthcare professionals the patient sees, and many times the only ones. Without nurses, the sustainable goals and the universal health coverage are but mere aspirations. As we look to the future, the nurses will continue to be an essential component of the healthcare, and their contribution will only become more critical. Some of the reasons is the ongoing global nursing shortage that are expected to continue in the coming years, and the demand for more skilled nurses will continue to grow, mostly because of the aging populations and that is the experienced nurses coming to retirement and the poor retention of the new nurses, which we have already discussed that in previous years in the increased investment in nursing, demand and supply shortage. Nurses involved in research, innovations, and exploring new treatment options and technologies to improve the patient's outcomes that calls for increased investment in nursing education and training. In addition, the nurses' ability to provide personalized and compassionate care in the digital world. 30% of the Indian national healthcare workforce in India is made up of nurses and midwives. Nurses has evolved to assume the most critical role in the vision of a healthy India. The INC was established to regulate the standard of nursing in India to empower nurses through training, capacity building, digitalizations, and development of nurse registration tracking system, which has brought many positive policy changes in the state of nursing status in India. India has also seen a phenomenal rise in the number of academic courses for nursing and the upgradation of institutions. And we can see even in Nagaland, the NHK and the School of Nursing DHT is also working on a project right now to upgrade the institutions for a degree course. The Ministry of Health and Family Welfare Government of India is also actively considering nurse practitioner as a new category owing to the ability to provide a comprehensive range of curative services. All these strengths and evidence, all these trends and changes shows evidence that nursing is changing and has called for actions to change. Nursing is not the same as it was 10 to 20 years ago. Whether we nurses like it or not, we are part of ever-changing healthcare system.
So viewers, ida ami khan la mojede de Trained Nurses Association of India Dimapur Unit President ami khan la mojede ase. To tai ekta duita question disa wo ai. Okay sir, ma'am, first of all, Happy International Nurses Day. Aro moi first video monja do apni khan ido nurse patients khan ke treat kra dem de. Noli encounter kra dem de apni khan do ki bhabna ki thoughts rakhina da khan ke treat koina.
Acha ido as achi principal bra role play bi dekai dise, so ami kan bi paratak especially emergency duty ina hua indi some patients, some public kan to ekdam ini target kuran nisna na takala intention kiba ekta takina ahanis nabi ahe oli kuno many of them bisi manu do hole bisi pal means kinaga hoina dai ahe kina relief Paigina chabo ito laka bhabana brabi ahe olibi itu kwa nisina kuno ba do ekdam kusabra ahe libi our American training law time di we have compassions na compassion kori na manoloko American kina hoina danda bra tiling koribo itu American ki shiki dikina ase so every time ito ja achi kwa nisina American bi itu patient party kan kiki kusa utia inaga temper bra helibi we remember our light our candles na kiniga amkan training lo time di kiniga bleach loise all these things we remember and with that we keeping in mind amkan paratak ido norm bra patients kan logodo public kan logodo kiniga hila norm bra dealing koribo ido kushes kore yeah.
Okay, ma'am, to this International Nurses Day, apni ki message diyo mon jesna viewers no di public kind.
Okay. I mean, again, just like a repetition, I mean, arukobo ito achi role play kura to palbert kai dise and then ajila dem do our nurses, our future. So ini nurses kan laka in a hospital setup, na. Hospital setup ekta de the doctors are the brain and we the nurses are the heart so American nurses can 24/7 hospital di takhakan do ini constant takado hole American nurses can ase so I just want to paratak aro government brabi hoilibi paratak nursing lakadi promote na nursing to promote correctly bishi balobo and then ajikali train bishi kuri kina ado kiko bo service na pai kina over age ho kina ito kan bishi ase so according to the public population kinika kuri ase ito nishina ado nurses bi na post creation bi ito kan bi kiba kuri dile ito kan bi sai dile salary dik time di tibo Bishim ano salary in 3-4 months napai kina bi kam kore ase so itu kan so pal bra ilakan khuri dile aro amikan our nurses our future ase itu nurses kan bra kineda pal bra koribo it's all for the public na for the hospital itu laka bhabana di amikan bi kori ase to ne ini ami laka message to iman alak to nohoy itu hi ase.
Thank you so much, ma'am.
Nagaland TV, Sop Manulaga Awas. Watch us live on Geo TV and on your television sets as well. For Dimapur viewers, we are on channel number 994 in Global Chapter, and Kohima and Mokokchung viewers, switch to channel number 138 on Hornbill Digital. For all news and updates, follow us on Facebook, Instagram, YouTube and Twitter.